So we're at the 2017 MDRA conference. I'm here with Dr. Ricky Greenwald. Dr. Greenwald is the founder and executive director of the Trauma Institute and the Child Trauma Institute. He's an affiliate professor at the SUNY University at Buffalo School of Social Work and is a fellow at the American Psychological Association. He's written numerous professional articles and a number of books, and he is here to talk about intensive trauma-focused therapy. So, welcome, Dr. Greenwald.
Thank you.
So, tell me about this format with the...
Okay. Well, intensive trauma-focused therapy is basically therapy done all at once. The way we do it is 9 to 5, several days in a row.
Mm.
So the rationale is, well, put it this way. You take your car to the shop. The mechanic says, you're driving on bald tires, that's really not a good idea. Tell you what, you come back once a month. Every time you come back, we'll replace one tire on your car, and in a few months you'll be good to go. That's what we do with our therapy clients. Now, we do it that way for some good reasons. For one thing, that's what insurance pays for, and so then people can afford the therapy and we can make a living.
Right.
Also, we've done it that way, and so it fits into our schedule because that's how our schedules are organized. And also, at one time, that made sense. When you're working incrementally on coping skills or developing insights and letting it percolate over time, etc., that hour per week makes a lot of sense. You get a little stuff done, you let it cook, you come back and you tweak it, you let that cook.
Yeah.
But with the advent of EMDR, now we're doing, I call it trauma healing. The technical term would be memory reconsolidation. There's nothing about memory reconsolidation that requires being chopped up into 45-minute weekly blocks.
Yeah.
So there's no benefit to doing that anymore. And when I talk to therapists as well as prospective clients about, would you rather just dive in and get it done this week or next week, or would you rather take a year or two of once a week to do it? Most people want to be better now and live their lives. Another thing about the intensive trauma therapy model is that it's faster, not only in that you get done soon. My rough estimate is that about a week of intensive gets done about the same amount as about a year of weekly therapy using the same methods.
Wow.
Still using the EMDR or whatever. So about a week per year. One reason is because you're cutting out all the hello and goodbye.
Yeah.
Another reason is you're cutting out all the coping skills, or most of the coping skills, which when you're working with somebody over the course of a year or two, you better work on coping skills so that they don't deteriorate while they're waiting for the trauma healing to happen, right? But they need the coping skills because they're traumatized.
Right.
And so they're reactive, they're not stable, and so they need extra skills. If you can just clear up the trauma, that's a better stabilization intervention than the so-called stabilization interventions. And there's research on that.
That makes sense.
So you're cutting out the hello and goodbye. You're cutting out most of the coping skill stuff. It's kind of like binge watching a season of a TV show, right? There's no ads, there's no recaps. Every minute is progress. So my very rough estimate is you're cutting total treatment hours by about 50%. And that has to be tested. I could be way off in either direction, but that's my rough estimate. You're also nearly eliminating dropout because they don't have time for their lives to disrupt. They don't have time. So, in today's workshop, I'll be reporting some results from, I think the first 50 people, give or take, in our Victims of Crime intensive trauma therapy program. And we had maybe 2 dropouts.
Wow.
Because when you're just coming for the week, you just do it. Whereas if it's once a week for a year, things can happen.
That's right.
People can move, they can go to jail, they can, you know. So I think this is going to become one of the standard therapy formats, not the only,
Right.
but you get results so much faster. Sometimes that means people can stay in school or not lose their job or not lose their family. I mean, sometimes that speed matters a lot. Other times it's just stop suffering that much sooner. So you get results so quickly. You're cutting down the dropout rate, you're cutting down total treatment hours.
When you present it that way to a client, I could see how there would be a buy-in on their point.
People like the idea.
Yeah, of course. But do you see a lot of resistance to this idea from therapists that are afraid that the client might get overwhelmed or that it might be too risky to expose
Well, yeah,
them?
because I know I'm talking to experienced EMDR therapists here, and we know that after a 1 hour or 1.5 hour session, some of our clients are exhausted.
Right.
Right. So it's hard to imagine how do you do that all day, and then the next day and the next day. So for one thing, when you know you're running a marathon, you kind of gird for it.
Mm-hmm.
And the other thing is people do what they can, and we will have some people who, I say, I'll be ready for you in an hour after the lunch break, but you come back when you need to. Some of them come back in exactly 60 minutes. Some take an hour and a half. They say, yeah, I took a walk. People do what they need to do.
Yeah.
Some people, if it's a 9 to 5 day, some people work till 4:55 when I say we got to tie it up. Others, it's 3:30 or 4. They say, I'm fried. I'll see you tomorrow. And that's all right. They still get so much done. And it's, I guess it can be hard to imagine, but I've been doing this for 7 or 8 years. We've got a staff of 9 therapists now. This is all we do. And people are doing it.
What struck me is, EMDR is such an organic approach, right? But then we try to fit it into this kind of regimented hour a week, once a week.
Right.
It fits with the model really well.
And that's another issue for some people, is that some people, even though in conventional weekly therapy, even though we save the last part of the session to help clients to put it away again and regain their composure, that doesn't always work.
That's right.
And a lot of the people that we get, and probably a lot of the people you get too, are refugees from other EMDR therapists who have said, I can't do that, it messed me up.
Right.
Right? It stirred me up too much, it destabilized me. And so that's another benefit of the intensive model, is you don't have to tell them to put away. You can let it run, and they get all the way through it.
Right.
Then you open up the next one, you let it run, they get all the way through it. So I do tell people, don't schedule a big job interview for the day after your intensive.
Right.
3 days or a week and a half or whatever it is. Because you might feel shook up for a while. There could be passing storms for a couple of days, but once it settles down, you're good.
Yeah.
So you reduce the risk of destabilization as well.
Got it. Thank you so much for sharing that model. That's great. If people want to find out more about your work, where could they go to?
Therapyretreat.org.
Fantastic. All right. Thank you so much for your time.